I'm guessing that everybody is in here because my clock is clicked to 11:30. I'm going to say good morning to everybody that's on the line. And Sarah, I need you to speak up if you haven't indeed opened this meeting, but I think you have.
Yes.
All right, thank you. Good morning, everybody. I want to start. Golly, by the way, I start every meeting that I have with people that we work with and telling you that we don't take for granted that this is in the middle of a busy day and you're a clinic owner likely or a leader in a clinic and giving us an hour of your time or even pieces of an hour of your time is no small feat. I promise you that we're not going to waste your time. I promise you we're trying to do a good job and the job we're trying to do is to help you navigate this world we live in where we're trying to change people's lives through better hearing for fun and profit. So I want to thank you for attending this webinar. We're calling it Making Insurance Work for You. Um, it is an opportunity for us to introduce ourselves to you in the form of um, we are officially an insurance billing and credentialing, or we officially have an insurance billing and credentialing arm at Acuity Hearing Network. So we want to start by opening the topic of insurance and I kind of think of a lot of people's insurance processes as I'm a big Christmas vacation guy, and I think about it like when Clark Griswold is working with his son to put up their Christmas lights. He pulls up a big box of lights and everything's just in a big ball. He's like, here you go, work that out. There's a little knot in there. I feel like we can make this easier for you to work in your clinics and make things go more smoothly. I am not capable of doing this at all by myself. Um, so I've asked Rebecca Muzels to be with us, and she leads this clinical arm for billing and credentialing. She and I were having this discussion here a little bit earlier, preparing for this call. I told her she's an expert, and she says, "Well, there's really no expert on all insurances in all states." And but what I mean by this is she's an expert from our end. Something that's unique about what we do at Acuity is we are solely focused on the retail hearing aid world, and in that world, Rebecca is an expert. And I'd like for Rebecca to introduce herself and really just kind of share your background, Rebecca, on how you wound up here today on this webinar with me.
Hi, thanks, Steve, and thanks everyone for coming today. As Steve said, I've worked in the hearing industry for several years now. I started back in 2009 in Oregon. I have worked this is my fourth company I've worked for, and I've done basically most of the back office functions from bookkeeping to human resources to front office management, administrative management in general, and also patient care administration. I worked in medical billing and credentialing, so I know from experience that the way we handle patient insurance in the clinic really has an impact across the board. Honestly, it touches all of those departments at one point or the other. So I'm just happy to be here today and share with you some of the knowledge that I have and hopefully answer some of your questions for you.
Well, thank you, Rebecca. I sure appreciate you being here. I want to remind everybody too that we will address any questions at the end. Should you have any questions in the meantime, I'd love it if you'd put them in the chat, and then we'll address those while we're able and while we're online today. I'll also remind everybody that if you have to get off of this call during the webinar, we do post it. I think it'll be posted here in a couple hours probably on our website at acuinghearingnetwork.com under Learn and then under Webinars. All of our webinars are forever posted there. And anything that we make, a special offer or call to action or whatever at the end of this webinar will be available to you as you've attended this. So having set those expectations, I want to get into some of the questions that I have is what makes insurance especially challenging in audiology? What pain points do clinics mention most often? Kind of think of those two things as we start walking through this process, Rebecca, and I'll listen as much as I can and learn as much as I can.
Um, so first and foremost, insurance takes a lot of time. There's a big trade-off when it comes to working with insurance, and we do it for the benefit of our patients. So, what are we spending time on? Can we shorten that time that we're spending? Are we spending it efficiently? Time is a really big issue when it comes to the clinic because at the end of the day, we want to direct our attention to the patients and give them the best information possible. Transparency, and so this is more pointing to the, the carriers themselves. So sometimes, you can call two different times and get different information. So transparency in terms of, what what are the details of this patient's benefit structure? Are we able to bill on behalf of the patient? And then ultimately, how do we communicate that to the patient? So we're not asking our clinic teams to be insurance experts, but we do need to arm them with basic tools and knowledge so that they can tell the patients to their best of their ability what to expect. Write-offs and returns. So tracking insurance AR can be a pain. A lot of times it's a who does what issue. And then again, the returns. So if a benefit does not pay out, at the end of the day, we might lose the patient. So it's really important that we're able to communicate this effectively. And then all of that together, employee morale as it relates to insurance. I feel like this is something that comes up often. If you ask anyone about insurance, their immediate demeanor changes. So just giving them the confidence to really feel like insurance is something they can tackle and that they have the resources behind them to do that.
I think that that's an interesting point you bring up that people's you can just see their faces change, and I don't care if it's a clinic owner, I don't care if it's a PCC, I don't care if it's a clinician. Um, it seems like, or a patient, it seems like nobody likes this process, and yet here we are. So is it your opinion, and I kind of know the answer of this, but it's taking a holistic view of what you want that patient experience to be like in getting clinicians, PCCs, and practice owners saying the same things or providing the same answers to similar questions. Is it accurate for me to assume that in most organizations that you've looked at for the first time, the answer a patient gets about insurance or the process that somebody says they follow in a clinic is unique to that specific person providing that answer to you at that point? Or do they have a process in place?
Yes, that's very common that it depends on the person, what the patient receives. And it's really, our job as clinic leaders to provide the map, which is what we'll go through in just a moment, to make sure that everyone is communicating consistently, and at the same time, depending on what process it is. So, one thing we found when we did this with our own company is that even in our leadership team, we had different answers for when certain things happen. So just imagine if we don't know, if we're not all on the same page, our teams also are probably not all on the same page. So um, again, what the best thing that you can do initially is to map out your process and um, so start to finish from when the patient first calls in or walks into your office all the way forward to after the claim pays. So it's not just a billing process. Yes, we file claims, we receive payment. I feel like that's very typical of any insurance resource that you use, but also providing the tools and the understanding to, go take the whole thing full circle and even pass the patient to, how are we following up on balances that haven't been collected that don't involve the patient necessarily. Let's show a balance that you're holding on your own books. So yeah, we like to think of insurance as a workflow And mapping out that workflow can really help you find the gaps and get everyone on the same page in the same system company-wide.
We're, one of the prompts that we have here is what happens when insurance responsibilities aren't clearly defined, and what do clinics tend to think of insurance? Why do they tend to think of it as just a billing issue? How do we view that differently? In that I know that as you scale and your business grows, it becomes more and more rare that you have a people problem and more likely that you have a process problem when you're running into issues. Can you tell me a little bit about some of the conflict that happens, or what's the downside to not doing anything about clearly defining a process system wide?
Sure. I mean, the main thing is that there are so many steps and there are so many people involved. So if you don't know who does what, then at any point it can fall through the cracks. So, the patient comes in, when do we collect insurance information? I mean, that's your number one question
Yeah.
to start the process. And then when do we expect to deliver a benefit verification to the patient? So that could happen, prior to the appointment. It could happen after the consultation. Depending, every company is going to be a little bit different depending on what contracts you have and what your teams look like. But all of those things are important. So at least know by when your patients would be aware of their benefits and who is doing the benefit verification call. So it could fall through there. And then also, how are we delivering that to the patient? So at our company, we have actual scripting for when and how to deliver benefit information to a patient, so what to expect. And then, is it at the consultation? Is it at the delivery? And then even later, because a lot of times it's information overload, are we following up on that information throughout the delivery follow-up process? So, hey, just want to let you know your claim got filed, things like that. So again, we're properly setting expectations for the patient. Ultimately, we want them to be able to receive their benefit, but also for them to be satisfied with the outcome. Then you have the billing itself. So who assigns the billing task to the biller, whether it's an internal or external biller? Who are you filing through? Is it a clearinghouse that's connected to your system or outside? And then again, how does that payer issue the payment? So how is it coming in? How are we tracking it? And then again, how we follow up on that claim. So how are you tracking the claims themselves and the payments and knowing when to appeal, or, what are we expecting versus what are we receiving? And all of that, ideally, you would take off of the front office or the clinical team itself if you can. Um, I know I've gone into several companies where insurance AR just becomes such a massive problem that you don't really know what's paid or not. Or if something's resolved with a zero payment and a balance is sitting there, is it due from the patient? Is it due from the carrier? So we like to be a little more proactive in that, in following up on our claims.
I think you can probably speak to this as well. Another thing that's unique to Acuity is the way we think about insurance. So some people might think that this webinar is about how to get paid in a timely manner. No, that's not what this is about. We look through everything first through the lens of better hearing is our agenda. And in order to achieve best hearing, we need to be prepared to use all of the tools that are available to us and have answers to all of the questions that are asked for us that drive the agenda towards better hearing. And if insurance is something that we decide to enter into that world because it's advantageous to us and to the patient's agenda of better hearing, then we want to do that. What we don't want to ever do is surrender and become an employee to an insurance company. Can you, Rebecca, kind of speak to how we, through staff interaction and I'll say culture building and teaching over long periods of time, how do we work with employees on making this about better hearing as opposed to being an employee of the insurance company?
Uh, that's a great question because I feel like sometimes it's easy to get focused on the insurance, the potential problems with the insurance, and maybe like coming across as nervous about it. But when it comes to insurance, it's almost the same as any other patient that we would receive. We have the methodology of the receive, relax, rescue. So, come on in, we'll take care
Oh,
of
receive, relax, rescue. Keep going. Say
you.
more.
So we'll take care of you no matter what. And that starts at the phone call. We actually, in our FAQs for insurance on our phone protocol, we say, yes, we work with all kinds of insurance. Now, that's not, again, it's important not to overpromise or to try to anticipate the benefit. It's just come on in, we'll take care of it when you get here, and we'll see if there's anything that we can do to help you take advantage of a benefit that you're paying into if you have one. So again, just receive, relax, rescue. We'll cross that bridge when we get there. And we do that also, when it comes to the claims filing. We do want to be transparent with our patients and keep them up to date throughout the whole process, but we also want to put them at ease that we're going to go to work for them. And that's what a lot of our training and tools are centered around.
I would gather that for the people on this webinar, they've never heard an insurance billing and credentialing specialist use those words receive, relax, rescue, or speak to this entire topic from a clinical operations perspective. They're usually just numbers people, and they're figuring out how to get paid. This is a really good example of a kind of culture shift that you want, so that people like Rebecca, who's on the back office support end and actually doing this, and people like me that are on the sales end of it, we're singing from the same hymnal, because we share the same culture, the same terminology. I like to say that there is freedom in routine. Steve Richards' trademark, there is freedom in routine. And what I mean by that is if you give your teams the exact things to say to the exact questions that they're asked, and everybody's doing the same, they know that they're doing a good job and they can focus on better hearing because they're not focused on how am I going to answer this question. They know how they're going to answer that question when it comes up. Um, and we use that phrase, receive, relax, rescue. That means whatever the patient's agenda is, we listen to it. Their agenda might be to what kind of insurance do you take my insurance? That's not their real question. Their real question is, did I come to the right place? So we'll receive that. We'll tell them, everybody calm down. Of course, we'd work with your insurance. We work with all insurances, but we're going to go and rescue and make better hearing the agenda. Before it begins, we go through a discovery and mapping process. Would you like to speak to this, Rebecca?
Actually, if it's okay, I may go ahead and share a couple of examples. I do feel like
Love.
we've some of the questions already. So these are kind of the four areas that you would center, I guess, the question asking around. So the patient communication, at what points during the journey are we talking about insurance and how do we respond to questions? Intake and verification, who does what and how, and when is that delivered? And then documentation and claims. So what paperwork are we providing to the clinics to give to patients? Is it clear? Do we have it, everything that we need? And then claims, who is scrubbing claims? Are we scrubbing claims? How it goes into the clearinghouse is super important because a rejection or a denial just lengthens the amount of time for the claim to resolve. And then payments and follow-up, are we set up for EFT where we can be? How would we go about doing that? So that our accounting teams can reconcile insurance payments in addition to private pay. And then following up on an insurance AR, is it, immediate? Is it something that has to be requested? When do we know when to write something off? Those are all important questions as well. So I'm going to go ahead and share just a couple of examples of the outcome of this type of conversation has been. So let me do this. And Steve, if you can let me know when it comes up, that would be great.
Ding, ding, ding. There it
So this
is.
is an example of a mapped out insurance process from start to finish. So um, this is not
This is an actual project that you did from start to finish, correct?
correct.
Yes.
Yes. So just to clarify, there is no one size fits all for insurance. Every company is different. You have different size companies. Companies have different contracts that have different requirements. So that's why I wanted to share a couple of examples instead of just one, so you can see the variation. So one thing you find is, again, the ordering of how things happen. When do we collect insurance information? When do we do verifications? If you need a referral or an authorization, who's doing that specifically? And is it done right after the phone call? Maybe if you're more heavy on service billing, that might come earlier in the process. Whereas if you don't bill for any services, it may be something that happens after the consultation. Um, so things like that. And then another thing that comes out in this process is the documentation. So insurance billing agreement, do you have one? What does it look like? Do the clinics like it? Things like that are important. What does your VOB form look like? Is it easily used? Also, we have a tool that, when going through this process, we found that VOB is a huge pain point for the clinics. So how can we and instead of saying when to verify benefits, we try to determine when you might not have to make that phone call. So just how frustrating it is to do the wait time with the carrier and be on the phone for up to an hour sometimes just to find out the benefit goes through a third party that you're not contracted with. So something like that, when can you avoid that? What do we know for sure? And again, it's going to vary per company, per state, et cetera. So that's something that came out of this process. And then, of course, we have our own internal billing team. So in some cases, this may be less people, less steps. But if you're outsourcing insurance, it might be even more important that from clinic to claim to payment, that you really know exactly what's happening there, because there's someone involved that's, outside of your organization. So that's really important. So here's just one more example so you can see how it could vary. So again, all the way from the phone call all the way up to the claim resolving
Can you
and
point
how
out
you
some of the
track that.
differences between the two and why?
Sure, sure. So this company had their own version of what we call the hearing aid benefits cheat sheet. So they have a managed care list. So they know, does this plan typically have a benefit? We don't want to make assumptions. So again, it's when we know for sure. So the rules. They have a difference between company one and when they do their verification. So you could potentially wait until after there is an outcome to the consultation to verify the benefit, depending on the company and your contracts and so forth. And that could save time as well. So, until the patient agrees to treatment, perhaps you're not doing a verification, or so it's really just making the most of the time that we are spending. When we need to do that, we can really put our energy behind it, as opposed to just kind of doing it every time just because we think that we should. um, and then so here we have a couple of different people involved. So there's an admin here. um, there might also be, like, some clinics might have the PCC delivering the benefit information prior to the consult. But here it's the provider that delivers that information. So just little variations like that. Again, who is tasking? So you might have like an insurance resource internally, even if you bill externally. So do you have a point person or resource within the company that can help manage that workflow, as opposed to every clinic sending, billing requests to whoever the biller might be? Little things like that. Both of these offices or companies use ClaimMD, and they bill through their patient management system. So that's a similarity. So just little things like that, Steve. But I would say, and all in all, these two processes are actually kind of similar, but just all those little inflection points that really could make a difference to how and when the claim pays.
So this is current state. How
Mhm.
long from the original state of the ball of Christmas lights to get to this state? What'd you have to do?
Um,
Really, what
I
did the
would
clinic owner
say,
have to do?
sure. Well, first of all, it's creating and publishing and training to your resources. So let's say, everyone gets together and we say, this is how we want it to flow. How do we make everyone in the company that's involved aware that this is the process? So
You
just to
mean you
kind of
can't just
show,
put this in front of them and have them all do it correctly?
no,
Okay.
unfortunately not. So I just wanted to share our patient insurance resources. So this could be the outcome potentially. So, you have your verification after sharing kind of the order in which things happen. So making sure these things are widely available and are known. That's another thing. Who should have access to provider portals that might assist with benefit verification, and how do you use those tools? So that's another thing that you would need to train to. In your system, when you're entering policies, making sure that people know what to select and that it's easily selectable. Um, we actually started over on our payer list in our system, which we use Council Ear, because everything was in there. And so we were having issues with the wrong plans being selected. So
Hmm.
just little things like that. How can we make this as easy as possible? Just setting people up for success. With in terms of billing, what does your insurance billing agreement look like? We have a little checklist that kind of reviewing. It's for the biller, but also for the clinic to look at. It seems like a lot, but it's just tiny little pieces of data in our system that need to be there before the task goes through. And then training resources. So we're still working on some of these, but these have to do with the recommendation. So this is an operational training video. So it's when the provider is making the recommendation and insurance is involved. What does that entail? What are we saying? And you would think, like, I feel like not a lot of people focus on that part. They focus more on the potentially the delivery of benefits part. But this is actually, when it comes to making a recommendation, which I think is unique.
What's
So
behind that? Can you click on the training videos real quick just to see what's
yes, one of them is for the phone protocol, and one is the recommendation. So we
okay.
actually have an audio recording of receiving insurance questions over the phone, and then the recommendation that takes place at the hearing consultation.
Okay. Thank you. I just wanted
Yeah,
to show
absolutely.
everybody that you know, there's some work that's out there and it's usable for any of our customers. That's really good information.
Um, that is, yeah, so that's kind of in a nutshell where you can go with this. And again, there's always room for improvement. I think talking to your clinic teams is super important as well, because
Mhm.
they're the ones that, you know, ultimately have to communicate. So, um, yeah, Steve, do you have any other questions for me?
Well, I do. One is when you first engage with somebody in the world of insurance billing, what is the most common uh, biggest mistake?
The biggest mistake. Um, That's difficult to answer. Um, I feel like it's often a lot of little things when it
Yeah.
comes to this process, but I do think maybe lack of clarity in terms of what the process is somewhere to start. Um,
Have you ever walked into anybody and they actually had a process flow chart like this?
like this, I think
Yeah.
that there have been, yeah, I've worked with people who've
Yeah.
had a process, but maybe not as granular
Okay.
as the
And
flow
probably not
chart.
the training behind it. What's the lowest hanging fruit that you could almost guarantee you're going to find when you're looking at somebody's business? uh, for the first time?
The lowest hanging fruit.
Yeah.
Um, I would think the follow-up after the claim is filed, because I think that creates the biggest, it can create the biggest headache because it involves, the clinics with their AR, it involves accounting, it involves the insurance team, whoever that might be. I think that sometimes we, tend to forget to go back and look at things to make sure they turned out okay. And sometimes it's as easy as having the right tracking process, whether it's in your internal system or, tracking outside, and even if it's just a spreadsheet or something of that nature. But kind of knowing where everything's at because it can be hard to keep track of.
Okay. Can we go back to the slides? Um, I want to see Sarah at this point. Have we had any questions?
Hey, Steve. I
Yes.
haven't seen any questions pop up
Okay.
in the
Uh,
chat yet, but we can open it up to questions.
yeah, it's not too late. If people have questions, feel free to ask them. But I'd like for Rebecca to explain what she can do for an Acuity Hearing Network customer. I mentioned that we do insurance billing. How much do we charge? Is a good question.
So what we'd like to offer is if anyone's interested in kind of having a conversation to map out your process is um, basically a free of charge up to 3 hour consultation to kind of go through your process in detail and see if there's anything that, any advice we can give. If, maybe your internal billing system is great and just a few tweaks would really improve something for you. But it would be good to have that conversation with any of you that would like to, and maybe help kind of see where your gaps are and where some improvement might take place.
And if somebody wanted to engage with you as a billing company, what would that look like and what would you charge?
So we charge a percentage of payments collected.
Mhm,
Um, and we actually bundle in our credentialing and contracting services with that.
mhm.
So it can be anywhere from 7 to 9%, depending on the complexity of the clinic and the insurance that you work with.
What is unique about working with us as opposed to some of the other billers out there?
So we like to, as Steve said, we come at insurance from a patient focus, and we like to work, start to finish with our clients to basically help them develop a practical insurance solution that, is helpful for them and their clinic teams and the patients that they serve. So it's more than just billing and credentialing. It's, helping you get through the whole thing, start to finish.
Okay. Thank you. We are offering a free 3 hour consultation, and Rebecca and her team, they'll actually produce some usable work for you to outline your actual workflow. Let's see where we're starting. And then I'll tell you, if you wanted to engage with us, what we would then do is we then work with you strategically. Okay, what do we want the future state to look like? And we get the rest of our team involved in that, whether it be, our HR group, our clinic operations group, our marketing group, all of these things where we can come and have everything work together for the benefit of your business. That's where, employing Acuity Hearing Network as a strategic partner happens. It's when we try to say, okay, here you are in this state, let's work together, see what you want this state to look like, and then we build a plan and we hold each other accountable to that plan to get to that spot. So I want to encourage everybody that is participating in this world to dream a big dream about what they'd want it to look like, because I think we can help them get here. Um, Golly, Rebecca, thank you for your time. I see that we have no other questions. Do you have anything to add before we finish up?
Nothing to add. No, just thank you again. I know your time is valuable, so we appreciate you being here.
We do appreciate you being there, and we hope everybody has a wonderful rest of your Thursday and then Friday, and then goodness, the weekend's right here. So enjoy. Thanks, everybody.